I want you to just picture a scenario for a second. You walk into a room, maybe it's a waiting room at a doctor's office, or even just an empty conference room at work.
Right, just a totally normal everyday space.
Exactly.
Yeah.
And there's nobody else there. It is completely quiet. So you sit down, you check your phone, and you're just, breathing the air.
Sounds pretty harmless.
It does. But what you don't know is that 2 hours ago, someone sat in that exact same room who was sick.
Yeah, and that is where it gets scary.
Right, because they didn't sneeze on you, they didn't cough in your face, you never even crossed paths with them. But just by walking into that empty room, you are now infected with a highly contagious disease.
It sounds completely like science fiction, honestly. I mean, we are so conditioned by recent history to think of infections as requiring close personal contact.
Yeah, like someone coughing right next to you on a bus.
Exactly, or sharing a drink, or touching a contaminated doorknob and then touching your eyes. The idea that a room itself can essentially be infectious long after a person has left, that really challenges our fundamental sense of safety.
It really does. But it's not science fiction. We are talking about the measles virus. So welcome to this deep dive. Today we're looking at a stack of recent medical data and epidemiological reports to figure out exactly what we're up against.
And we've got some pretty heavy-hitting sources today.
We do. We're looking at CDC data, comprehensive clinical profiles from staff roles, and some really eye-opening reviews from the Curious Medical Journal that break down the dramatic 2025 United States measles crisis.
Which was a massive wake-up call.
Huge. So our mission today is to unpack the biology of what might genuinely be like the perfect pathogen. We're going to explore how an illness that the U.S. successfully eliminated back in the year 2000 somehow roared back with such force a quarter century later.
And crucially, we want to look at what that means for you, the listener. We really need to understand why maintaining our collective firewall of immunity isn't just, a public health talking point. It's something that directly impacts your daily life.
So to even begin to understand the 2025 outbreak, we have to look at the virus itself. Historically, because this virus was so incredibly common before vaccines, practically everyone caught it as a kid.
Right, it was just seen as a given.
Totally normalized.
Yeah.
People dismissed it as just an inevitable childhood rite of passage. But underneath that normalization is a mechanical powerhouse of a pathogen. It comes from a family of viruses called Paramyxoviridae, and it spreads through the air.
Yeah, the airborne factor is key here.
But I know that saying it simply spreads doesn't really capture the reality of it. Just how efficiently does this thing actually move?
Well, efficiently almost doesn't do it justice. The clinical data shows that if one person has measles, up to 9 out of 10 unprotected people nearby will catch it.
Wait, 9 out of 10?
9 out of 10. To put that into a broader perspective, in epidemiology, we use a metric called R0, pronounced R0. It's the basic reproduction number.
Okay.
It essentially tells us, on average, how many people one single sick person will infect in a population that has zero immunity.
Okay, let's unpack this for a second. Give us a baseline. What's the R0 of something we're all super familiar with, like the virus that causes COVID-19?
So if we look at SARS-CoV-2, depending on the variant, the R0 is generally estimated to be somewhere between 1 and 6.
Okay, 1 to 6. And measles?
Measles boasts an R0 of 14 to 18.
Oh, wow.
Yeah, it exists in a completely different stratosphere of contagiousness.
That is insane. Because, numbers like 14 to 18 can feel really abstract. How does it physically do that? Like if I sneeze, those are usually heavy droplets. They travel a few feet and then gravity pulls them down to the floor.
Right.
So how on earth is measles infecting up to 18 people?
Because it's not relying on those heavy sinking droplets. It becomes aerosolized. Think of the measles virus not as like water from a spray bottle, but more like microscopic smoke.
Microscopic smoke, okay.
Yeah, so when an infected person coughs or even just talks or breathes heavily, they are releasing thousands of tiny viral particles that hang suspended in the air currents. They just drift.
And they stay there.
They can stay perfectly viable floating in that airspace or just settling really lightly on surfaces for up to 2 hours.
So it's less like a sneeze and more like a microscopic glitter bomb.
A glitter bomb, I like that.
Yeah, like if someone pops a glitter bomb in a room, that dust just hangs in the air forever. You walk in 2 hours later, you're going to get glitter on you.
That is a perfectly accurate way to visualize it. And what makes it so successful once you inhale that glitter is its precise biological machinery.
The structural stuff.
Exactly. The virus has a specific structural protein on its surface called the hemagglutinin protein, or HA protein. This HA protein acts exactly like a skeleton key.
Okay, so it unlocks something.
Right. It is perfectly shaped to effortlessly lock on to the receptors of your cells in your respiratory tract. Because that connection is so highly optimized by evolution, you don't need a massive viral load to get sick.
So you don't need someone coughing right in your face.
Not at all. Inhaling just a tiny amount of that suspended invisible smoke from an empty room is enough for that skeleton key to latch on, open the door, and begin the invasion.
Which brings us to what happens once it's actually inside. We mentioned earlier that people used to dismiss measles as just a rash and a fever.
Right, the classic childhood illness.
Yeah, but the medical profiles we reviewed paint a much, much darker picture. The true danger of measles isn't what it does on the surface.
No, not at all. I mean, the surface symptoms are miserable, certainly. The classic presentation involves the 3 Cs.
Right, I saw that. Cough, coryza, and conjunctivitis.
You got it. So a severe cough, coryza, which is an intense, constant runny nose, and conjunctivitis, meaning very red, inflamed, watery eyes. And before the rash even shows up, a doctor might look inside the patient's mouth and see Koplik spots.
Okay, yeah, I saw that term in the research. What exactly is a Koplik spot?
They look like tiny grains of white sand surrounded by a red ring located inside the cheeks.
Weird.
Yeah. And in medicine, these are considered a definitive tell. If a patient has Koplik spots, you know with absolute certainty they have measles. Nothing else causes them.
Wow, okay. And then comes the fever.
Exactly. Shortly after those spots appear, the patient's fever can spike dangerously high, up to 104 degrees Fahrenheit. And then you get the classic rash descending wave of red flat spots that starts up at the hairline and slowly marches down the entire body.
That sounds absolutely grueling, especially for, like, a young child. But from what I read, the rash is essentially just collateral damage, right?
Pretty much, yeah.
The real horror story is what the virus is doing to your immune system while you're distracted by the fever. One of the clinical papers described it almost like a Trojan horse.
It is a phenomenal infiltrator. When you inhale those aerosolized particles, the virus doesn't just attack your lung tissue. Its primary targets are your body's lymphocytes and dendritic cells.
Whoa, back up for a second. What exactly is a dendritic cell, and why does the virus care about it? Let's break that down.
Sure. Think of your immune system like a massive, highly coordinated military base. Dendritic cells are your frontline scouts.
Okay, the scouts.
Right. Their entire job is to capture foreign invaders, analyze them, and then race back to the lymph nodes to show the rest of the immune system what to attack. They are the messengers that sound the alarm.
So the virus is deliberately targeting the scouts?
Yes. The measles virus infects the scouts, and it doesn't just hitch a ride. It uses specific non-structural proteins to actively suppress the body's production of interferon.
And interferon is?
It's the chemical distress signal your cells use to scream for help. So by suppressing it, the virus essentially cuts the alarm wires before the immune system even knows the base has been breached.
That is terrifying.
It is.
And the fallout from that infiltration leads to what the research calls immune amnesia. Can you walk us through what that actually means? Because that sounds awful.
Well, this is perhaps the most devastating long-term effect of a measles infection. To multiply, the virus forces the body to produce massive amounts of measles-specific immune cells.
Okay.
But your body has a limited amount of space for immune cells. To make room for this new army, the virus essentially kills off your previously established memory cells.
The ones that remember other diseases.
Exactly. These are the cells that remember how to fight off all the other illnesses you've survived in your life. The common colds, the stomach bugs, the minor bacterial infections.
Wait, so it doesn't just suppress your immune system temporarily, it actually wipes your immune system's memory.
Yes.
It's like a computer hacker maliciously reformatting your hard drive so your body completely forgets how to fight off basic bugs it already knew how to beat.
What's fascinating here is that is exactly what happens. It hits the factory reset button on your immunity. And this amnesia doesn't just fade away when the measles rash clears up either.
Really? How long does it last?
It can leave your immune system compromised for weeks, months, and in some cases, up to 3 years.
3 years. That completely flips the script on how we view the danger of this disease.
It does, and it explains a massive piece of the mortality puzzle. When we look at measles deaths, it is very rarely the viral rash or the initial fever that kills the patient.
Right, because of the amnesia.
Exactly. The leading cause of measles-related mortality is secondary bacterial infections. Because the immune system has been wiped clean, organisms like Streptococcus pneumonia can just walk right in unopposed. Pneumonia is the most common fatal complication because the body literally forgot how to fight it.
And the complications don't stop at pneumonia. I mean, the clinical profiles list blindness, which is tied to the way the virus severely depletes vitamin A in the body.
Yes, that's a huge issue globally.
But the one that absolutely stopped me in my tracks was SSPE, subacute sclerosing panencephalitis.
That is a tough one to read about.
It really is.
Yeah.
The research described this as a progressive, fatal neurological disease. But what blew my mind was the timeline. A child can get measles, seemingly recover perfectly, go back to school, grow up, and then 5 to 10 years later, they develop a fatal brain disease. How is that even possible? 10 years later.
It's a slow-motion tragedy, honestly, and it represents the worst-case scenario of viral persistence. In very rare cases, a mutated version of the measles virus manages to cross the blood-brain barrier during the initial infection.
Okay, so it gets into the brain.
Right, and because it's mutated, it doesn't replicate normally, and it manages to hide from the immune system inside the brain cells. It essentially goes dormant.
Wow.
Then years later, for reasons we still don't fully understand, it reactivates. It begins slowly destroying the brain tissue, it causes cognitive decline, seizures, and eventually it is universally fatal.
That is, I mean, there are no words. So, if this pathogen is a biological wrecking ball, if it has an R0 of up to 18, the ability to delete our immune memory, and can lurk in the brain for a decade, how on earth did it find a foothold in the U.S. in 2025?
That is the big question.
Because the United States officially declared measles eliminated in the year 2000. It was gone. So how did we get here?
To understand the 2025 resurgence, we have to transition away from virology and look closely at human behavior and public health infrastructure.
Okay.
The epidemiological review from the Curious Journal provides a very stark timeline. By May 30th, 2025, the U.S. recorded 1,088 confirmed cases of measles spread across 33 states.
And it wasn't just cases either. There were 3 deaths. The first measles fatalities in the U.S. in 20 years. 2 children and 1 immunocompromised adult.
Yeah, and the most critical data point is this. Over 90% of those cases were in individuals who were entirely unvaccinated or whose vaccination status was unknown.
Over 90%.
Yeah. The outbreak didn't happen because the virus mutated to beat the vaccine. It happened because the virus found the people who didn't have the vaccine.
Right. And the review traces the initial spark to early January 2025. An infected traveler returned from overseas to a close-knit community in West Texas.
That was the index case, yes.
But a spark only starts a fire if there's dry tinder. Why was there so much dry tinder in 2025?
Well, it comes down to a concept called the herd immunity threshold. Because measles is so incredibly contagious-like, remember that R0 of 18 we talked about? You need an incredibly high percentage of the population to be immune in order to stop the virus from jumping from person to person.
And what's the magic number?
For measles, that threshold is roughly 95%. You need 95% of the community vaccinated to build a wall high enough to block it.
And the data shows that the national kindergarten coverage for the 2-dose MMR vaccine had slipped to 92.7%, which, sounds high.
Yeah.
Like if I get a 92 on a test, I'm pretty happy. But for measles, 92% is a failing grade.
It absolutely is. And as you know, national averages can be incredibly deceiving. While the country as a whole was at 92.7%, human populations don't distribute evenly.
Right, of course.
There were localized pockets, entire counties, specific schools where coverage had plummeted into the 70s and 80s. Those localized pockets are the dry tinder.
So what caused the drop?
Yeah.
The sources outline a few major drivers,
Right.
Because we want to make sure we're looking at this objectively based on the data.
Yes, the reports are very impartial about tracking the drivers of vaccine hesitancy. A significant lingering factor is the long shadow of a completely debunked article published in The Lancet back in 1998, which falsely suggested a link between the MMR vaccine and autism.
And just to be completely clear, that has been studied to death, hasn't it?
Absolutely. There have been massive multinational population-based studies involving over 1.2 million children that definitively disproved any link whatsoever.
Right.
The paper was retracted, the author lost his medical license, but on the internet, misinformation has a half-life that outlasts the truth.
It really does.
Additionally, the reports point to a growing preference in some demographics for natural immunity, as well as the severe systemic disruptions to routine pediatric care that happened during the COVID-19 lockdowns. Kids simply miss their routine appointments, and many never caught up.
Here's where it gets really interesting, though. I found the demographics of this drop in coverage to be fascinating because it completely defies the stereotypes we often hear. You can't just point to one specific group of people.
No, you really can't.
The review highlights a real demographic paradox. You have pockets of vulnerability clustering in highly affluent, highly educated communities like wealthy ZIP codes in California and Colorado, where natural lifestyle and wellness movements are very popular.
Right.
But at the exact same time, you have specific religious or cultural communities declining the vaccine for faith-based reasons.
Right.
And then, on a third front, you have rural areas facing intense healthcare access barriers. People aren't necessarily ideologically opposed to the shot, they just literally can't get to a clinic, or they don't have a pediatrician in their county.
It highlights a very complex vulnerability. When misinformation is amplified by social media echo chambers, it travels vastly faster than evidence-based public health messaging.
Yeah.
When people lose trust in medical institutions or when they simply lack the basic access to get the care they need, they skip the 2-dose MMR vaccine. Which is a tragedy because that vaccine is remarkably safe and 97% effective.
And by missing those doses.
By missing them, society unknowingly constructs these pockets of dry tinder, just waiting for a traveler to step off a plane and provide the spark.
Which brings us to the reality of the modern world. That traveler in West Texas didn't just stay in West Texas. If you drop a highly contagious virus into a local community, it doesn't stay local.
Exactly. The genomic and epidemiological tracing of the 2025 outbreak showed that the virus quickly hitchhiked along domestic airline routes and tourist destinations. The index cluster in Texas quickly seeded new outbreaks in states like Colorado and Illinois.
Let's actually visualize that, because I want to talk about what it physically takes to stop an outbreak once it starts. If a person with measles walks through a crowded airport terminal with an R0 of 18, the logistics of tracking that are just mind-boggling.
It is a public health nightmare, honestly. If someone infected with measles spends 2 hours in an airport terminal, contact tracers don't just have to find the people who sat next to them on the plane.
Right, because of the invisible smoke.
Because the virus aerosolizes and hangs in the air, the health department has to track down every single passenger on that flight. The flight attendants, the TSA agents who screen them, the janitorial staff, and anyone who happened to be sitting in the food court in that same terminal during that window.
That perfectly explains the staggering financial cost mentioned in the data. The sources noted that managing a single measles outbreak costs public health departments an estimated $47,000 per case.
Yes.
Per case. If you have 1,000 cases, you are suddenly draining tens of millions of dollars from local health budgets just to make phone calls and track down exposures.
And many local departments simply couldn't handle it. In epidemiology, there is a gold standard benchmark known as the 717 timeliness target.
What does that mean?
The goal is to detect a suspected outbreak within 7 days, initiate the public health investigation within 1 day, and have effective control measures fully implemented within 7 days.
Well, I'm guessing a virus that spreads to 18 people at a time doesn't respect that timeline.
It shatters it completely. During the 2025 surge, the 717 target was severely compromised. Local rural health departments in Texas, which were already understaffed, were suddenly dealing with contact tracing backlogs of 48 to 60 hours.
Oh, man.
Vaccine stockpiles in these rural counties were literally depleted in a matter of days. It is incredibly labor-intensive.
It's like an understaffed, underfunded fire department trying to chase down a dozen separate brush fires at once while literally running out of water.
That is a very accurate comparison.
And the international data shows this isn't just a U.S. problem either. The review brought up the tragic 2019 outbreak in the Pacific island nation of Samoa.
Right. That was a heartbreaking situation.
Their vaccination coverage had plummeted to around 30% due to a tragic medical error that eroded public trust. When measles hit, a tiny country of just a couple 100,000 people saw over 5,700 cases and 83 deaths, mostly children under 5.
Devastating.
Even the United Kingdom, a massive wealthy nation, lost its WHO elimination status in 2018 because a prolonged outbreak allowed the virus to reestablish endemic transmission.
Which brings us to the ultimate question of why this matters to the individual listener.
Right. Because I can hear someone listening to this right now thinking, well, my parents got me my 2 doses of MMR when I was a kid. I'm fully vaccinated. The virus is terrifying, sure, but I'm protected. So why should I care if other people choose not to get the shot?
You should care because your individual immunity doesn't exist in a vacuum. Even if you are personally protected from the virus, an outbreak in your community directly impacts you.
In what way?
Well, as we discussed, it drains tens of millions of dollars from your local public health resources. It diverts doctors and nurses at your local hospital away from routine care. But far more importantly, a drop in vaccination rates directly threatens the most vulnerable people in your life who actually cannot be vaccinated.
The people who rely entirely on the herd immunity wall.
Precisely. We are talking about patients actively undergoing chemotherapy for cancer whose immune systems are compromised. We are talking about infants under 12 months of age who are simply too young to receive their first dose of the MMR vaccine.
Right, they just have to wait and hope.
Yeah.
Yeah.
We are talking about pregnant women and individuals with autoimmune disorders. These people cannot build their own armor against measles. They rely entirely on the 95% herd immunity firewall around them to survive. When coverage drops, you are pulling bricks out of that firewall, and when the wall crumbles, the fire reaches them.
It really forces you to realize how deeply intertwined our health is. Your choices don't just affect you.
Not at all.
So to wrap this all up, we've covered a lot of ground today. We looked at the terrifying mechanics of the measles virus, how it aerosolizes like invisible smoke, using its hemagglutinin protein as a skeleton key to become a superspreader with an R0 of 14 to 18.
We explored the hidden damage it causes beneath the rash, specifically the immune amnesia that wipes out your body's ability to fight off secondary infections, leaving patients vulnerable to pneumonia and severe long-term neurological diseases.
And we saw how the 2025 outbreak proved, without a shadow of a doubt, that this virus doesn't care if a country declared it eliminated 25 years ago. It is just waiting for us to drop our guard. It will immediately exploit any cracks in our community's vaccination coverage, overwhelming our public health infrastructure in the process.
Being a well-informed citizen means recognizing that public health is exactly that public. You are an active participant. You are a vital brick in the wall that protects the most vulnerable members of your society. We have an incredibly safe, 97% effective tool to stop this pathogen.
We do.
The tragedy of 2025 wasn't a failure of medical science. It was a vulnerability in our collective behavior.
Which brings us right back to where we started. Imagine that empty room again, the invisible threat lingering in the air long after the sick person has gone. Medical science has already invented a physical vaccine that neutralizes that physical threat completely. We've had it for decades.
Decades, yeah.
But as the 2025 crisis showed, the real pathogen driving this resurgence wasn't just a virus. It was misinformation. It spreads faster than any biological agent, infecting our trust and fracturing our communities. So we want to leave you with this to mull over. If medical science has the power to cure physical viruses, how do we begin to develop a cognitive vaccine to immunize society against the viral spread of health misinformation?